Well, it's Monday, so that means Dr. Levine is here for your answers and questions to all medical and health questions. Welcome, Doctor.
Thank you.
Did you make it through the Christmas holidays okay?
I did. It was safe, sound, cold, so I loved it.
That's what Christmas is all about.
That's correct.
All right, let's get started here, shall we? Because
all right.
Obviously the flu is a huge topic of conversation these days. From Robbie, she says, has anyone who's been admitted to the hospital for H1N1 survive?
Personally, I don't know. I mean, there probably are some statistics on that each hospital has. I don't know those personally. A lot of times it has to do with diagnosing the H1N1. A lot of times we don't get proper collection when the person comes in. We assume that they might have a flu-like illness or a viral-like illness and treat them accordingly. Sometimes our diagnostic capability is limited, so I don't know the answer to that. I know that the flu is always around, and it does kill people every year. I don't think we talk about it enough, so this is typical of this season.
Okay. This one's from Greg Kerr. If you're around little kids, are you more inclined to become sick? The kids that maybe go to daycare and they have runny noses and all that stuff?
I mean, I think so, certainly if you have kids. I mean, that's why the pertussis vaccine came into play recently for patients 65 and older. Because of the interaction with adults and kids, they certainly are around a lot of kids who are also infected. And so, yes, I think so. And certainly that's why we recommend getting the flu, getting to your doctor if you feel like you have an illness, because it's all about community protecting itself as well. That's another big reason to get the flu vaccine.
They also say kids can be cesspools for disease as well.
Absolutely, but adults as well. I mean, we share a lot of illnesses like that, and there's always a concern about what's causing the increase in allergies, and I think it's important for kids to get out there and mingle with the other kids.
All right, this is from Crystal. I've always had a normal heart rate, 65 to 70, but for the past few months I've had a heart rate between 46 and 50. What could be causing this? I
would probably think of medications first, but if they're not on any sort of medications, if she's not having any symptoms, it's not a bad problem as long as they're not symptomatic. If you are in shape, a lot of times your pulse rate will decrease. Right. So as long as you don't have symptoms, I'm not too concerned. But if symptoms develop, certainly get into your doctor, maybe get an EKG, ultrasound, maybe some other heart testing.
Yeah, if you're doing cardiovascular exercise, it'd be great to have a 46 to 50.
Absolutely.
Brittany's saying, asking, what is the best way to protect your child from the flu if they're not old enough to take a flu shot, 4 months old? I know to keep him away from people, but I have to take him places sometimes, no choice.
Yeah, I think she's doing the best she can. I mean, they can't live in a bubble. They have to mingle with the environment. Certainly if someone's ill, probably don't carry your child around that ill person. It sounds like she's taking some practical advice, and just common sense is probably what I'd recommend.
Kelly, I was positive for type A influenza on the 26th. It lasted a few days, and I started feeling a little better today. But today I started running a low-grade temp again, and my whole body aches, and I'm coughing like crazy. Do I need to go back to the doctor?
I probably would, because you can get a second infection. There's several flu viruses out there, so sometimes you can get 2 infections. So I probably would go back, certainly if the patient's having symptoms.
From Stephen, yes, I'm a 35-year-old male. I have pain more than normal, and at times it fills my locks up. What could be wrong?
A lot of times, you can have arthritis in your body. You can have infection. Sometimes it can be abnormal blood work, so I'd probably get into the physician, get a physical, get some blood work to figure that out. It's kind of a nonspecific presentation.
All right. Last question before we hit halftime.
All right.
Here. From Stephen, yes, I'm a 35-year-old male. No, I've already asked that one. Oh, let's go to Elizabeth. I noticed a small lump under the skin on my 1-year-old daughter's groin area. What could be the cause? It
could be an enlarged lymph node, could be an abscess, could be just a sebaceous cyst, something benign. A lot of times if there are lumps, we like to biopsy them or remove them. Certainly if it's growing or if it's painful, those are some abnormal signs, and probably we'll get to the physician a lot of times to either remove that or biopsy that. That's the way we can tell.
Okay. We're going to take a quick break, and when we come back, more of Dr. Levine to answer your medical and health questions right after this. Well, we are back with Dr. Levine. We've had some people text in or email questions. This is a pretty good one. Are warts associated with any disease, diabetes, or cancer? What causes them?
Typically viral infections causes warts, normally benign, can be removed if anatomically are problematic for you. So typically a virus, less likely cancer or diabetes.
So does compound W always seem to work for that?
I think if it's small and it's not in an unusual area, I think that's something to try. But if it's large, it's going to need something surgical to remove it.
Okay. How does someone wean themselves off pain medication like hydrocodone?
I think that's difficult, especially if you've been on them for a prolonged period of time and you're taking a lot. I think if you've been on it for a few weeks, you're taking a couple, you just stop it and there shouldn't be a problem. But there's some people on some really high dose narcotics out there, and typically they need to do that under the supervision of a physician, and normally you either just basically wean yourself off of it slowly over several weeks. There are some other medications that can be substituted for that, like Suboxone is very popular for patients who are having problems with narcotic issues. So try to do it under the supervision of a physician if you take a lot.
That also become a mental situation as well, saying you've got to make the effort to take yourself off that pain medication, because it certainly feels good, I would,
Chronic pain is such a miserable situation. I just wouldn't put it on anyone. People who had motor vehicle accidents tend to have the most chronic pain I've ever seen in most patients. And it's just terrible. You can't get rid of it. You're in prison, you're in jail, and patients get pretty desperate a lot of times. So it does become psychological, I would agree. A lot of times patients get insomnia, depression, anxiety, a lot of psychiatric illnesses, and typically we supplement their treatment with those types of medications to try and help deal with the pain. So a lot of times you need to be under the supervision of a trained professional to try and deal with that. And the goal is to try and control the pain as much as possible. Some people never reach zero pain most of the time, maybe 15%, 25%.
Okay. 85-year-old man itching below knee on leg in the middle of the night. What wakes him up? What could cause this?
I probably would think of neuropathy. We discuss that a lot on the show, a very common issue. For the most part, sometimes it's unknown cause, but some other common causes would be diabetes, poor circulation, or medications such as some of the cholesterol medicines.
Okay.
Yep.
63-year-old with a sore throat for 5 weeks, throat culture negative.
I probably would think of acid reflux. It's such a common issue, gastritis, acid reflux, tickling in the throat, hoarseness, sore throat when you wake up. Yep. Another thing I would think about is if this person's overweight, obstructive sleep apnea is a very common issue because the throat gets very narrow, the air gets very turbulent, it traumatizes the throat throughout the night, so they wake up with a very sore throat.
Interesting. Acid reflux can cause that.
Absolutely. When you lay down, if you are overweight, the acid can irritate the vocal cords and the esophagus, and so yes, you can wake up with a sore throat. Certainly if you have hoarseness, get a ENT to evaluate your vocal cords and your throat. Could be a polyp or malignancy.
Okay. 46-year-old woman with a knot on her wrist appears and disappears on wrist, lasts for a month. So something that's reoccurring.
Yeah,
like
it sounds like maybe a benign cyst. Anytime it goes away, that typically means it's benign. If it grows and gets larger, that tends to promote or predict malignancy. Probably needs to be biopsied or surgically removed, or x-rayed.
Okay. Eva K says, I have numbness, tinkling. Hello. Tinkling. Yeah, tingling.
Yes.
I think she meant tingling.
Yes.
And feels like a pin sticking in me on my back, now spreading down my back. What could this be?
Yeah, neuropathy, probably degenerative joint disease of the lumbar spine. As it progresses, it tends to impinge on the nerves, and that will cause some tingling and numbness in the appropriate area down the buttocks, the back of the leg, and the foot.
All right, appropriate last question. Why is this nasty cough from Beth taking a month or more for everyone to get over it?
Some people just have a cough that lasts for a long period of time. We never know who that person's going to be, but I see it all the time. So we try medications like Tessalon Pearls, cough medicines, sometimes inhalers. Probably need a chest x-ray if it lasts a long time.
All right, if you have any questions for Dr. Levine, we have several ways you can get them to us. You see our station address. You can post to Facebook, or you can email us at LAFlive@5@KFDM.com. Thanks again so much for being here on this Monday.
Thank you.
Happy New Year, by the way.
Likewise.
All right.